Now let's do an example and then we'll start our next topic. So a 16-year-old female is brought by her mother after she has fallen down while in a shopping mall, but recovered fully in less than a minute. The mother says that her daughter did not eat anything for 4 days because she has admitted that she is obese and she needs to lose weight. The girl is sweaty and her blood glucose is 2.4, her BMI is 18. The girl refuses to be admitted. What should be done? What should be done in this case? So the diagnosis here is anorexia nervosa, and the female has not eaten anything for 4 days. Her BMI is 18 and she is sweaty because of her blood glucose is 2.4. So what step or what is the best or most appropriate management in this case?
Is it to admit her because her BMI is 18 and she doesn't look stable either?
Yes, BMI is 18 and she has a medical problem that is hypoglycemia. So no matter whatever the BMI is, if she has any medical complication, you will admit her to medical ward. So compulsory admission to the medical ward, although her BMI is not very low, that is 18, she has hypoglycemia, admission as hypoglycemia might be fatal if not corrected. Remember that blood glucose of less than 4 is considered hypoglycemia. Other features of hypoglycemia that include sweating, tachycardia, and confusion. Seeking a legal advice is inappropriate because of the urgency of the situation. So she is, you can see that this girl refuses to be admitted. So we need to admit her against her will because seeking legal advice is inappropriate in this situation, because if hypoglycemia is not corrected promptly, then it can lead to fatal complications. As she refuses a voluntary admission despite her serious complications, she is likely lacking insight and thus needs to be compulsorily admitted under the Mental Health Act. So Mental Health Act says that if someone is suicidal, then you are going to admit him or her against his or her will. So that's why compulsory admission to the medical ward in this case. Another example, a 19-year-old female BMI 21 thinks that she is obese. She eats uncontrollably and then feels guilty and thus performs self-induced vomiting. So uncontrolled eating followed by guilt and followed by weight loss mechanism. This is a classic case of bulimia nervosa. An 18-year-old female BMI is 17.8, has bilateral parotid swelling and thickened calluses on the dorsum of her hand. So what is the likely diagnosis? Because the BMI is more than 17.5 and there is bilateral parotid swelling. So as we discussed that bilateral parotid swelling is more common in bulimia nervosa. So in this case, your diagnosis should be bulimia nervosa. Another example, a 19-year-old female has obsessive thinking that she is overweight. Her BMI is 14.5. So her BMI is less than 15. She abuses laxatives and heavily exercises. Her blood pressure is in the normal range. Heart rate is 70. So because there is no medical complications, so we'll refer this patient urgently to an eating disorder unit. Now we are going to discuss some psychological conditions that are related to unexplained symptoms. And the first of them is somatization disorder. Somatization disorder. Somatization means so many symptoms. So many symptoms without any physical cause. So the first criteria or the first uh, important diagnostic point for somatization disorder is so many symptoms without any physical cause. And the second point is the patient usually refuse to accept the reassurances or negative test results. For example, a 30-year-old female complains of abdominal pain, headache, shortness of breath, unsteadiness, palpitation, numbness of lower limbs for several months. ECG, X-ray, neurological examination, and abdominal ultrasound shows normal findings. The diagnosis here is somatization disorder because she has many symptoms such as abdominal pain, headache, shortness of breath. So you can see that in our previous lecture, we discussed a disease that was chronic fatigue syndrome. I think it was in derma. Chronic fatigue syndrome. In chronic fatigue syndrome, the only complaint was chronic fatigue. That is usually started after an respiratory tract infection. And in chronic fatigue syndrome, all the lab investigations are normal as well. But here you can see that in somatization disorder, there are many symptoms which are involving all the different organs of the body, such as abdominal pain, headache, shortness of breath, unsteadiness, palpitation. But ECG, X-ray, neurological examination, and abdominal ultrasound, all they are normal. So we cannot find any physical cause of these symptoms. So the likely diagnosis here is somatization disorder. Multiple physical symptoms, and patient refuses to accept reassurance or negative test result. The diagnosis will be somatization disorder. Now the second disorder in unexplained symptoms is hypochondrial disorder or hypochondriasis. What is hypochondriasis? Hypochondriasis is uh, when the mm, when the person think that there's an underlying serious disease is present. For example, cancer and HIV. So if someone thinks that an underlying serious disease is present, then the diagnosis will be hypochondrial disorder or hypochondriasis. For example, a woman persists that she has pancreatic cancer, just like her dead husband. A woman persists that she has HIV despite several negative screening tests. A woman believes that this benign lump is cancer despite all reassuring investigations. Another example is a minor headache is caused by a brain tumor. Tiredness is caused by HIV. A mild rash is the start of skin cancer. So a minor symptoms will be associated with an underlying serious disease. So if this is the case, then your diagnosis will be hypochondriasis. And the other name for hypochondriasis is illness anxiety disorder. That is anxiety of illness, anxiety of underlying serious illness. So hypochondriac disorder or hypochondriasis can also be called as illness anxiety disorder. For example, a woman with depression after the death of her husband has completed 6 months of SSRI, and thus uh, she stopped taking her medication. After a while, she develops a feeling that she has pancreatic cancer, just like her dead husband. So the likely diagnosis is hypochondrial delusion. The next step is neuropsychiatric analysis. A 40-year-old woman who presents to the clinic with 1 week history of multiple physical symptoms, headache, abdominal pain, urinary frequency, bloatedness, physical examination, and investigation are normal. What is the most likely diagnosis of her condition? It is somatization disorder. Now, another disease is Munchausen syndrome or factitious disorder. So many physical symptoms without any physical cause. and refuses to accept reassurance or negative test result, the diagnosis will be somatization disorder. Now, what is Munchausen syndrome or factitious disorder? Remember that in Munchausen syndrome, there will be intentional production, falsification, or fabrication of physical or pathological signs and symptoms, mostly to obtain medical attention. So, faking physical signs and symptoms to obtain medical attention, the diagnosis will be Munchausen syndrome. Intentional, these are intentional. While the physical signs and symptoms that are present in somatization disorder, they are not intentional. And they are not for or to gain a medical attention. In Munchausen syndrome, the patient will fake the symptoms, physical signs and symptoms to obtain medical attention and treatment. For example, a woman always present to hospital complaining of abdominal pain and bloody stool. She brings a stool sample from home and is never able to produce a stool sample at hospital. So uh, her stool samples and urine tests are normal. This is the third time in the same month she visits the hospital. Her abdomen shows multiple scars of laparoscopies. She insists on getting more investigation, although no abnormalities are found. So in this example, you can see that a woman is trying to get medical attention by faking the symptoms of abdominal pain and bloody stools. Though her urine analysis and stool examination is completely normal, but she still persists that she has bloody stools and abdominal pain. And to prove her point, she brings a stool sample from her home and never able to produce a stool sample at hospital. So in Munchausen syndrome or factitious disorder, the patient can go to the extent that they bring their test samples from the home. The diagnosis in this case is Munchausen syndrome. She is likely to be intentionally inserting blood into her stools at home to seek medical attention. Previous laparoscopies are done looking for the cause of her symptoms and abdominal pain, but none has been found. She still insists on more medical attention. She has abdominal pain, but as the doctor cannot discover the cause, she is fabricating the signs. Now, Munchausen syndrome by proxy. In Munchausen syndrome by proxy, parent or carer produce factitious illness in a child or adult in their care. This is known as Munchausen syndrome by proxy, that a parent or a carrier produces factitious illness in someone else, not in her or himself, but someone else. For example, in their child or an adult in their care. Now, malingering. Munchausen syndrome and in malingering and in Munchausen syndrome, and both of them, in both the scenarios, in both the diseases, the person fake the symptoms. Fake the symptoms. The only difference between these two is that in Munchausen syndrome, the person fake the symptoms for seeking medical attention, while in malingering, the person usually fake the symptoms or exaggerate the symptoms for financial or other gains. So if someone fake the symptoms for medical attention, then it is Munchausen syndrome. And if someone fake the symptoms or exaggerate the symptoms for financial or other gains, such as compensation to avoid military services, to obtain an opiate prescription, then the diagnosis will be malingering. So feigning symptoms for medical attention, the diagnosis is Munchausen syndrome, and feigning symptoms for secondary gains, such as for compensation, for financial gain, to avoid military services, or to obtain an opioid prescription, then the diagnosis will be malingering. Now the next disorder is conversion disorders. What is conversion disorder? Conversion disorder is loss of motor or sensory function without organic cause. Remember that again, that in conversion disorder, the patient does not fake the symptoms, or the patient does not intentionally produce the symptoms. There is usually loss of motor or sensory function without any organic cause because it is a psychiatric illness. And the patient does not consciously or intentionally fabricate the symptoms. For example, a 30-year-old female is brought to the hospital with limbs paralysis that develop after she has witnessed a car accident. So she witnessed a car accident and she developed limb paralysis. So how someone can develop limb paralysis with just witnessing a car accident? So this is most likely conversion disorder. Another example is a 29-year-old female witnessed a tragic car accident in which a boy had died. She could not sleep remembering the event. The following morning, she woke up unable to see. She has no previous medical or psychological history. So a woman developed blindness. The woman developed blindness after a car accident, after witnessing a car accident, or develop limb paralysis. The diagnosis will be convergent disorder. Loss of motor or sensory function without organic cause. The diagnosis will be convergent disorder. The person can develop paralysis, blindness, or mutism. The person can become mute. Now, the next disorder is dissociative disorder. Dissociation is a process of separating of certain memories from normal consciousness. Dissociative disorder is basically a type of multiple personality disorder. In which the person usually dissociate or separate of certain memories from normal consciousness. In contrast to convergent disorder, dissociative disorder involves psychiatric symptoms such as amnesia, stupor, and hope. The treatment for dissociative disorder and convergent disorder is psychotherapy or cognitive behavioral therapy. Now we discussed two conditions in which the person usually fake the symptoms. One was Munchausen syndrome or factitious disorder, and the second was malingering. In Munchausen syndrome, the person faked the physical symptoms to gain medical attention, while in malingering, the person fake medical symptoms to get secondary gains for secondary gains, such as financial benefits or avoiding military, etc. Now, there's another disorder in which a person usually fake the symptoms of a psychiatric illness, that is Ganser syndrome. As its name indicates, or it is common in gangsters. Ganser syndrome is common in prison inmate. That's why it is also known as prison psychosis, because it was first observed in prisoners. So what is Ganser syndrome? Cancer syndrome is usually present in prisoners, in which the prisoner usually fake a symptom of psychiatric illness to obtain an early parole so that he can be freed from the jail. For example, a prisoner was taken to hospital. He complains of hallucination. When he is asked questions, he provides wrong answer, but in the correct category. For example, when asked who is the Prime Minister of England, he answers Bill Clinton. So he provides wrong answers, but the answer is in the correct category. The category of the answer is correct. He is telling the name of the Prime Minister, but not the Prime Minister of UK, but some other country. And he is faking these symptoms of hallucinations, that he is hearing voices, etc. So if this is the case, then our diagnosis will be cancer syndrome. So a person deliberately and consciously act as if she has a physical or mental illness when she or he is not really sick. People with cancer syndrome mimic behavior that is typical of a mental illness, such as schizophrenia. It is common in, it is also known as prison psychosis because it was first observed in prisoners. So cancer syndrome is a prison who claims mental illness to get a parole or release. Now we discussed in the previous lecture mania and hypomania. Now some other types of mania is pyromania, erotomania, and trichotillomania and kleptomania. So what is pyromania? Inability to resist impulses to deliberately start fires in order to relieve tension or for instant gratification. So if someone deliberately start fires for his gratification or to relieve tension, then this is known as pyromania. Erotomania is when a delusional belief that a famous person is secretly in love with them. So if someone think that a famous person is secretly in love with them, then it will be known as erotomania. Trichotillomania is trichotillomania is impulsive urge to pull out one's hair, leading to noticeable hair loss. So if someone impulsively pulls out his or her hairs, which lead to noticeable hair loss, then it will be known as trichotillomania. And kleptomania is inability to refrain from stealing. Now, some common types of delusion. Delusion of reference. What is delusion of reference? A false belief that insignificant remarks, events, persons, or objects in one's environment have personal meaning. So insignificant remarks, if someone falsely believes that insignificant remarks in his life has a personal meaning, then the diagnosis will be delusion of reference. For example, a person thinks that a TV show, a female newscaster is directly communicating to him when she looks at the camera and when she says some words. Another example is that a person thinks that someone constantly gives him special messages through the newspaper, or a person believes that another person on the billboard outside his window is sending messages that are meant specifically for him. So this is delusion of reference. Delusion of reference is when someone falsely believes that insignificant remarks, events, or persons or objects in one's environment have personal meaning. Now, what is hypnagogic hallucination? We discussed this in previous lecture as well, and we'll discuss it here again. Hypnagogic hallucination is hallucination that a person get while falling asleep. For example, hearing a voice calling one's name, which then shocks you back to vigilance to find out that no one is there. So if person hear voices while he is going to sleep, then it is known as hypnagogic hallucination. And if the person hear voices while getting up from sleep, then it is known as hypnopompic hallucination. Remember that hypnagogic or hypnopompic hallucination, they are frequently experienced by the normal healthy people. So they are not a symptom of mental illnesses. Now, the second type of delusion is delusion of control. Delusion of control is that when someone believes that his uh, actions, thoughts, behavior, feelings, or impulses is controlled by outside forces. For example, a man says that his friend had made his own right arm to swing out to hit a stranger. So a man is saying that his arm is being controlled by his friend. This is known as delusion of control. Can someone tell me what is the other name for delusion of control? We discussed it in schizophrenia in yesterday lecture. Can delusion of control be called as passivity phenomena as well?
Thought, it is a thought withdrawal, something like that.
That was thought disorder. Here,
So
the person thinks that his actions, his behavior, his feelings, or his impulses. So, what was passivity phenomena? So, you can say that thought disorder is different from delusion of control, because in thought disorder, a person thinks that someone is putting thoughts in his mind or withdrawing thoughts from his mind, or there is thought blocking. While in a delusion of control, the person thinks that his thoughts are controlled by someone else. We in the yesterday's lecture, we discussed a phenomena that was known as passivity phenomena. So, what is passivity phenomena?
So any sensation or which is controlled by the external influences.
Yes. So we can say that passivity phenomena is a type of delusion of control. And we can include this thought disorder also in this category. That passivity phenomena and thought disorder, uh, uh, they are a type of delusion of control. So the next type of delusion is delusion of guilt. What is delusion of guilt? Feeling guilty or remorseful for no valid reason. For example, the person will say, I'm responsible for the war, I'm responsible for the hurricane, floods that occurred in the city or in another country, and thus I need to be punished. The next type is grandeur delusion or delusion of grandiosity. When the person thinks that he is famous, powerful, wealthy, or he has exceptional abilities, talents, and keep praising themselves. Persecutory delusion is when one believes that he is treated with malicious intent, hostility, unfriendly way, or harassment. So, if someone falsely believes that people are plotting against him, or people has malicious intent against him, or he is being harassed, then this type of delusion is known as persecutory delusion. Nihilistic delusion, we have already discussed nihilistic delusion in the previous lectures, that in nihilistic delusion, the person thinks that he is dead and he should be buried. And it is a common feature that is present in which disease? Nihilistic delusion is present in which psychiatric condition?
Schizophrenia?
Narcissistic delusion is a common feature of psychotic depression. So whenever you see narcissistic delusion in the Plab 1 exam, then your diagnosis will be psychotic depression. Though it can be found in schizophrenia, but is very rare in schizophrenia. For Plab 1, you need to remember that narcissistic delusion is a feature of psychotic depression. Now, some disorders that are associated with delusional misidentification. One is Capgras syndrome, and the second one is Frogly delusion. What is Capgras syndrome? Capgras syndrome is when someone falsely believes that someone they know or recognize has been replaced by an imposter or pretender. Capgras syndrome is also known as delusion of double. Delusion of double means someone believes that someone they know is replaced by an imposter or pretender. For example, they accuse a spouse of being an imposter of their actual spouse. For example, the person will say, "You look identical to my husband, but you are not him. You are an imposter." And another example is a young man is not allowing his father to enter in the house as he thinks that he is replaced by an identical looking imposter. So Capgras syndrome, you can say that it is basically a delusion of double. While in Frogly syndrome, a person holds a delusional belief that different people are in fact a single person who changes appearances. For example, a young man thinks that every old man he meets is actually his father, even though they look different. But he is sure that they are his father, but wearing a different disguise. So in short, in Capgras syndrome, the person will say you look like him, but you are not him. And Frogly, two people are one person, but their appearance is different. Is it clear, everyone? Capgras syndrome and Frogly delusion. Clang association, we discussed clang association that it is an abnormality of speech where instead of meaning, the relation between words is their sound. It is a feature of mania. So it can occur in mania. For example, the person will make noises such as systemic, symbiotic, empathetic, genetic, paramedic. The heart is prosthetic. So clang association usually sound a bit similar to rhyming poetry, but the poems does not make any sense. Othello syndrome is a delusional jealousy when an individual suspects his or her faithful partner of infidelity like adultery, cheating, or even having an affair with someone else. So delusional jealousy and suspicion about his or her faithful partner of infidelity, the diagnosis will be Othello syndrome. Ekbom's syndrome is a delusional belief that the person, his body or his skin or his environment is filled with parasites. So delusion of parasitosis is known as Ekbom syndrome. Remember that Ekbom syndrome is different from Whitmark-Ekbom syndrome. That is also known as restless leg syndrome. Restless leg syndrome is when someone complains that insects are crawling in his skin. So if someone says that insects are crawling in his skin, then it will be Whitmark-Ekbom syndrome. Yes, I think it's being recorded. Yes. So Ekbom syndrome is delusion of parasitosis, and Whitbeck-Ekbom syndrome is feeling of insect crawling in the skin. So do not confuse these two diseases. They are different. Pressure speech, flight of ideas, features of mania. We already discussed them. Erotomania is also discussed. And Gangster syndrome or gangster syndrome or prison psychosis is also discussed. Now, another disease or syndrome is Todd syndrome. Todd syndrome is also known as Alice in Wonderland syndrome. The patient may feel that their body is expanding or getting smaller. So if someone feels that their body is expanding or getting smaller, then the diagnosis will be Todd's syndrome or Alice in Wonderland syndrome. The next one is Folly Dukes. Folly Dukes means madness of two. When a delusional belief is shared by two individuals who are in a relationship, such as husband and wife, then this is known as folly dukes or madness of two. Once separated, the delusion resolves in the second person. The first person should be assessed and treated in the usual way. So folly dukes is madness of two. Now some common phobias. Claustrophobia is irrational fear of confined spaces. Acrophobia is fear of heights. Ranchophobia is fear of spiders. Hedinophobia is fear of snakes. Zoophobia is fear of animals. Aerophobia is fear of flying. Astrophobia is feeling of thunder and lightning. Autophobia is fear of being alone. Hemophobia is fear of blood. Hydrophobia is fear of water. And agoraphobia is fear of open spaces, such as scared of traveling on a public transport, scared of visiting a shopping mall, scared of leaving home. It is associated with intense anxiety, palpitation, sweating, hyperventilation, and nausea. Rejected stalkers are those who follow their victim in order to reverse, correct, or avenge a rejection. For example, a divorce, separation, or termination. Now, this is a summary of important management of important psychiatric conditions that we discussed in their concerned topic. So it's just a small revision. So our psychiatry is finished.